Uh, I welcome you all for this evening meeting, and today is our 200th episode. And these VMS webinar series are directed to help elderly people, older adults, as well as their caregivers. The title is Healthy Aging Talk Series. That's what we have put. And today is the 200th episode, and this is a landmark to in a way kind of mark this occasion. We have invited the PG students to come and present, and we had a good number of people who had sent their abstract. From that, we shortlisted 12 people who are going to do the presentation. Each of them will have 5 minutes and 5 slides, and we have a jury who will also mark and will take into account the previous marks also, and then we announce the winners later. But more than that, I think participation is important. The whole idea of this exercise is to ensure that some of the PGs or most of the PGs learn about this public awareness, how different it is, the talk while you are doing the public awareness compared to the ones that you do as a scientific for your fraternity. So we have with us chief guest, Professor Shikala Bharat. We welcome Madam.
Thank you.
And I take this opportunity, I will wish her happy birthday also on this occasion. And she is with us. And with us we have Chairperson Professor P.T. Sivakumar, who is our head of the unit, Geriatric unit, Department of Psychiatry. Also we have our team members, the DM students, as well as our fellowship students, the technical person from our NDA helping us, supporting us, as well as we have in the studio the people from Bangalore Medical College who have been shortlisted. At my request, Dr. Shankar and their HOD has allowed them to come here to present, so that it will be a good exercise here. Also, we have the presenters from JJM Davangere who will be doing online, as well as KIMS Bangalore. So without much delay, I'll ask Dr. Divyashree to start inviting people one by one, and let's focus on the program first, and let us finish one by one, and then we'll have a brief discussion at the end of the presentation. Over to you, Dr. Divyashree.
Hello everyone. I'll be ringing a bell after 4 minutes, so that will be the first reminder for the participants. So they will have 1 more minute to wind up the presentation, and after 5 minutes, the second bell will be ringing. Over to the first presenter. She's Dr. P. Hasita from JJM Davangere Medical College. Her topic is loneliness. So welcome, Dr. Hasita.
That name is somewhere down. Where is Harshita?
Harshita, not there.
First, P. Hasita.
Oh, that is okay. I put her as
In
Padmini.
Zoom, we can actually put the.
Good evening, everyone. I hope I'm audible.
You are.
I'll be sharing my screen for the presentation.
Yes, madam. Carry on.
Is my screen visible, sir?
Yes, ma'am. It is.
So are you ready, Dr. Hasita?
Should mute this.
Okay. Your time will start now.
Good afternoon, everyone. Today, I, Dr. Hasita, psychiatry resident from JJM Medical College, Davangere. I'm going to be talking on the topic loneliness. So what is loneliness? Loneliness is the feeling of being alone or lacking meaningful relationships or companionships. So even if a person is surrounded by family, friends, loved ones, or colleagues, they will end up feeling socially isolated or feeling alone. On the other hand, Positive loneliness is choosing to be alone for self-reflection, which leads to personal growth and mental peace. This has been there and it's prevalent in our ancient Indian philosophy, and it has been explained in Vanaprastha and Sannyas Ashram stages of life. These stages of life depict the life after a person is retired and their children grow up. However, positive loneliness is not possible for everyone. So, loneliness is otherwise an unpleasant feeling which can be present in both young and the elderly. However, in the elderly, it is more prevalent because of major life changes which they encounter during that stage of life. So previously, if a person has been employed, they will be occupied between their working hours, that is, say, 9 to 5 job. But after retirement, there will be a void during that time period wherein they won't have anything to do. They will also encounter a loss of spouses or friends or family members, and relocation. Relocation of children moving out of the house, growing up and marrying themselves, or friends migrating from nearby places can cause an empty nest syndrome. Their own physical illnesses, commonly arthritis or diabetes, can confine them more into their own homes, causing disability, thus increasing loneliness. Also, lack of strong family ties or support from the family itself can further increase these feelings of loneliness. So these have negative impact on our lives. Loneliness has negative impact on life. It worsens physical health. That is, it increases heart problems, causes stroke, or causes memory problems, or increases uncontrolled diabetes or hypertension. It also affects mental health, causing depression and worry, anxiety, sleep and appetite disturbances. It also increases the vulnerability of these elderly. So these people will be at risk of physical or verbal abuse or mental abuse from their caregivers. It also makes them more susceptible to frauds like financial frauds or crimes like robbery or dacoity. So it is important to overcome this loneliness. So how to manage this loneliness? These can be done by easy ways. First is encouraging physical activity, that is encouraging exercises. So walking, dancing, jogging, or laughing clubs, which usually happen in public parks or public spaces, can help them increase their physical activity as well as widen their social circle. Also, increasing socialization with friends and family, both near or far, by learning new technology or social media will help them reconnect with their old friends. It is important to make transport available at a subsidized rate or free of cost for senior citizens so that their friends or family can be accessible and they can travel whenever they want. Although there is a lot of stigma attached with old age homes or daycare centers, these centers like old age home, accessible housing or daycare centers will help them interact more with people of their own age. So it can be beneficial as well. They lack a routine which they previously had in their lives. So developing a new routine through religious groups, community or volunteering services, or part-time working can help. Inculcating happiness through adopting pets or reviving old hobbies or developing new skills like learning a new language or a new instrument can help them. So the take-home message is that loneliness is an underappreciated global threat which needs immediate concern, and addressing loneliness needs proactive steps by the person themselves, their family, friends, as well as some dedicated organizations like HelpAge India or Nightingale's Medical Trust, which can help the vulnerable elderly to combat loneliness. Thank you.
Person is Neha.
Thank you, Dr. Hasita. The next presenter is Dr. Neha from BMCRI, Bangalore.
Since this is a competition and 5 minutes for each participants. We are not taking any questions. You're welcome to comment in the chat box. It's okay. We won't be asking any questions to the presenters. Okay, thank you. Sharda. Never. Can you all make it red? It's not red. Okay.
Ladies and gentlemen, good evening.
Is it audible from the?
She's in mute.
Yeah, that's red.
Start your time.
Yes.
Just check with them. Somebody should check.
Should be white.
Yeah, good evening. Am I audible?
You are audible. You are audible.
Okay. Good evening, ladies and gentlemen. It's a privilege to speak with you today. I'm Dr. Neha, and today I'm going to talk about something that's often avoided, but very inevitable, death and dying. Now, before you start thinking this is going to be all doom and gloom, let me assure you it doesn't have to be. We all know that death is a part of life, just as much as birth. And as we age, it's something that we think about very often. But why not approach it with a little of humor and lot of wisdom? So after all, laughter is considered to be a best medicine. So let me start off with a story about a village in India where people live very long lives. So when approached an elderly gentleman who was 120 years old about his secret, he replied saying that, I don't think about dying. I'm more involved in other activities that I don't have time to think about dying. So the valuable lesson that we all can learn from this is be engaged and not worry about things that are quite inevitable. Bhagavad Gita says that death is an inevitable part of life, a natural transition that leads to rebirth and thus should not be cause for grief. So we live in a culture that prizes prolonged youth and vitality. That is, the natural processes of age and decline are very stigmatized. This prime example for this is our ever-growing hair dye industry, wrinkle-free creams. So this leads to a pervasive inability to cope with the reality of death. So this results in something like a denial of death. So people are unable to accept the final chapter of their lives. Coming to chronic illnesses like cancer, stroke, paralysis, and dementia, these which affect elderly population, they usually amplify the stress associated with the prospect of dying. So this is not only for the patients, but also for the caregivers. So these conditions, they cause prolonged physical suffering, emotional turmoil, and a sense of helplessness. And all these can be very overwhelming. The unknown sense of fear can lead to increase in anxiety.
It's muted.
Again, you are muted, ma.
You can.
Can you hear now? Yes, doctor.
Okay. So family members usually have a dual burden, that is to provide care as well as cope with an impending loss. So these mental health consequences need to be acknowledged. And this will happen when death education is integrated into hospice and palliative care. Such education helps patients and their families to understand the dying process, and demystify their fears and promote emotional and psychological preparation. So this results in a very more holistic approach. Patti Smith, once a famous writer, once said, "It's part of privilege of being human that we have our moment when we have to say goodbye." So we need to view death as a fundamental aspect of human experience. And when this acceptance comes, not only helps the individual who is facing death, but also the family members to cope with their emotional turmoil. So ultimately, acceptance fosters a more compassionate and a peaceful end of life experience, allowing all involved to say goodbye with grace and dignity. So I'll tell you another story with a man who was not afraid of dying. So when asked why, he says, "If I'm alive, what is the point in worrying? And when I'm dead, I'm no longer there to worry." So this is a very simple way of telling that dying, there is no point in worrying about dying because it's inevitable. So let's focus on the living. And if all of you are not convinced by that, I would like to talk about our own Bollywood Kishore Kumar, who says, "मैं जिंदगी से आगे निकलता रहा और हर एक फिक्र दुआ में चलता रहा." That means to say that I continued living and all my worries just evaporated in smoke. So we can take a page out of all these wise old souls and maybe face death as we also face living, with a little courage, a little sense of humor, and a little sense of mischief. Thank you.
So thank you, Dr. Neha. Our next presenter is Dr. Triveni from BMCRI, Bangalore.
That automatically goes off. Huh?
Sometimes.
That yours or somebody else's?
Mine.
Am I audible?
Yes, ma, you are audible, ma, you are audible.
Good evening, everybody. Myself, Dr. Triveni M. Gowda. I'm Psychiatry PG from BMCRI. Today, I'll be talking about elderly care homes. So, care homes are involved caring for elderly persons who cannot manage themselves partially or wholly. So, why are we talking about it? Because there is increase in demand for elderly care homes. That is because of in response to aging population and increased demand for care, there have been surges in residential care homes in globally and in India. This can be because of decline in traditional familial and social support. That can be because of reduction in fertility rates, smaller nuclear families, increased urbanization, decline in traditional social networks, and migration of children to other cities. So this has led to the increased demand for care homes. So what do care homes do? They provide social support by enhancing quality of life, well-being, by boosting emotional well-being, fostering a sense of belonging and enhancing self-esteem, as we can see in the picture. So it also, many would appreciate the security and medical attention which has been provided in elderly care homes. Some would prefer their own homes despite the past neglect or care. This can be because of difficulty in adjusting to new environments, declining health, social isolation, and witnessing frequent illness and death in the care homes. And one more thing is people who will come from low socioeconomic strata, they cannot afford to this expensive elderly care homes. So what are the facilities which should be given in elderly care homes? So residential care facilities must adapt to meet the specific needs of the elderly. These can be tailored toilet facilities, specialized nutritional plans, physiotherapy, environmental modifications to prevent falls, as we know that elderly are more prone for falls, and avoid pressure ulcers. This should also be including some of the leisure activities like painting, crafts work, and sports activities, which are suitable for elderly people. And there should also be regular medical consultations and mental health support, as we know that cognitive stimulation is very important and to manage people who are very agitated. And as we can see in the picture, having a scheduled routine is very important. As my fellow friend told that for loneliness, structured routine is very important. And along with that, it provides predictability. It reduces stress, and it also help in improving sleep. As my friend is going to tell about sleep, so it also helps to improve the sleep quality in elderly people. So you should have a scheduled routine for elderly people, and if residential care homes incorporate this scheduled routine, it will be very helpful. And as we can know, there are different types of elderly care homes, starting from adult daycare to hospice care. So adult daycare is normal daycare, which we can see in children, and it is cost effective, and day-to-day activities are ensured there. And we have retirement community, senior apartment, and in-service home care, nursing home, where 24/7 care is provided by the trained nurses. And hospice care, it is similar to a palliative care, which is end-life support, which can be given both at home or special centers. And one such concept is dementia village, where the residents are encouraged to move freely throughout the community and to continue the normal daily activities which they were doing priorly, such as going for shopping, grocery shopping, or gardening, or grabbing a dinner at restaurant, or going for salon, much more. So these activities are provided there. Along with them, the caretakers are lived by, and it is usually these villages are surrounded by a beautiful landscapes. We have such a dementia village in Bangalore, in Yelahanka, which is called Nisika Dementia Village. The first dementia village was established in the Netherlands in 2009. So I want to conclude by saying that elderly care homes are vital to our healthcare system by enhancing seniors' dignity and quality of life. So moving forward, we must continue to improve and adapt these services to meet the evolving needs of our aging population.
Thank you, Dr. Triveni. Next is Dr. Abhishek from BMCRI, Bangalore.
Can you check the audio once?
Yeah, he's audible now.
We'll make it to full screen. According to present and read. The arrows, yes. So, warm welcome to everyone. So, already we know what is going on today. So, as a part of the VMS initiative, so a series of presentations are being presented to you. So, my topic, the one that I have chosen, is mobility and falls, staying safe and active. So, myself, Dr. Abhishek from Bangalore Medical College. So, firstly, I would like to start off by saying, why do we need to talk about mobility and falls? A lot of the elderly already get a lot of information about the strokes or heart attacks or other medical comorbidities, but this one thing is not very often spoken about, but it is a very essential part of the quality of living of elderly. So I will be going into some numbers. So initially, so why do we need to talk about falls? So there are statistics to say that 1 in 4 older adults fall every year. And out of these people who have a fall, they are twice as more likely to have another fall in their lifetime. And one more dangerous or very alarming statistic is that every 20 minutes, an older adult dies from a fall. And these falls are the leading cause of... Sorry about that. So the leading cause of falls are the leading cause for head injuries and broken hips in adults who are age 65 or more. So this falls as per se also have effects on the elderly, and also more than that, they affect the daily activities of living. So after a fall, so they can become dependent in their self-care, their mobility, and even feeding, taking bath, all of these gets affected. So which can cause further worsening of their quality of life. So the first step of prevention of falls is to identify the people who are at risk of falls. So broadly, I've just put up the categories or sections under which the risk factors can be clubbed. And the first one is biological. So by biological, I mean, which is already a part of their body or their functioning. So in terms of elderly who are already visually or hearing impaired, so they're higher risk of falls. So there are people who are demented, who have hypotension, arthritis, or joint mobility dysfunctions. So they can be at a higher risk of falls. The second category is being medications and drug use. So a lot of the elderly are on multiple drugs, and some of the things that are some of the medications that are culprits for this are sedative ones. So mainly your seizure medications or benzodiazepines or antipsychotics. And also certain hypoglycemics can cause drowsiness and increase the risk of fall. And so one other thing is alcohol use that can be clubbed under this category. The third one being environment. So there are other aspects like bad lighting in the indoors, slippery flooring, potholes or sidewalks when they're outdoors, stairs without railings. All of these increase the risk of falls. And also under the socioeconomic category, so living alone, so especially elders who cannot afford to be in care homes where they have assistance 24/7. So living alone or low income where they're not able to procure aids to help their mobility, and lack of safe transportation. So these are all risks for falls. So coming to how we can reduce the risk of falls. So as you can see in the pictures, so we can classify it into how they can focus on being more active. So vigorous or moderate exercise can be practiced, 75 minutes of vigorous activities or 150 minutes of moderate intensity physical activity, or a combination of both is what is recommended usually. So by vigorous, I mean running, sports, or climbing stairs, and moderate can be walking, swimming, and cycling. So I'd also avoiding sitting time or reducing sitting time and taking breaks in between can go a long way in helping mobility. Building strength, as in going to gym, practicing yoga, some form of dance, Zumba. So all of these can improve the balance and then so coming to some of the modifications that can be done at home. So some of the environmental risk factors can be targeted by using guardrails, especially in the bathrooms where the floors can be slippery, avoiding loose cables or loose things around the house. So clearing up clutter and having certain devices which can alarm. So especially in people who are living alone, they can have wearable devices which can alert individuals when they're at a distress or have sustained an injury. So coming to the take-home messages, I'll quickly go through. So firstly, accidental falls are leading causes of head injury and hip fractures. So identifying the risk factors and addressing them can reduce the risk of falls. Improving mobility, balance, and strength by regular exercise and participating in sports. A good protein-dense foods rich in calcium, vitamin D, and C can improve bone and joint health. And finally, the environmental modifications, which can be made very easily, like improving lighting, having proper flooring, guardrails, and so by this, I would like to conclude by saying not only preventing falls, we can improve the quality of life of elderly by taking these simple measures. Thank you.
Thank you, Dr. Abhishek. Next up is Dr. Adira from BMC Bangalore.
Check if you're audible, and then you can start.
Good evening, all. Am I audible?
You are audible.
Good evening, all. Myself, Dr.
It is full screen.
Good evening, all. Myself, Dr. Atira, first year PG from Department of Psychiatry, Bangalore Medical College. First of all, I would like to thank everyone for giving me the opportunity to speak today. I would be talking about chronic pain, something that affects majority of the elderly, and it is often hidden or misunderstood at times.
Any issues you have?
Next.
I think There is nothing.
Nothing good, nothing good.
That's what-
Joy.
I think the PP is not moving.
The slides are not moving.
Do you want that to move?
Imagine like waking up in the morning, like with a constant nagging pain every day, which affect your life, throughout. And
Audible.
She is audible. She is audible. No problem. Go ahead, ma. Go ahead.
so it will be really difficult for this individual to go ahead in their life. Also, like chronic pain.
Please feel free to complete. No, don't worry about the complete. Use it.
Imagine like waking up every day with a constant nagging discomfort, something that lingers for months or years together, a pain that is invisible with no clear diagnosis. It can be a daily struggle and can affect the life profoundly. So in the next few minutes, we will look into what chronic pain is, why it happens, and most importantly, how can we better manage it. It's a pain that lasts longer than 3 months. It can be constant or it may come and go, making it very challenging to live with. It can happen due to various conditions like arthritis, osteoporosis, degenerative disc, nerve damages, chronic disease like cancer, diabetes, wear and tear in the muscle and joints, previous injuries, lack of physical activities. Living with chronic pain can affect more than just your body. It can affect your sleep, your energy. Imagine trying to go about your day when you're always in pain. It's exhausting, both physically and emotionally. It can lead to isolation, depression, and anxiety. There are various strategies that can help reduce the intensity of the pain and to improve the quality of life, like medication, physical therapy, mind-body techniques like meditation, yoga, healthy lifestyles, like including balanced diet, good sleep, regular exercise. Of course, we should not underestimate the power of support, whether it be family, friends, therapists, so support group. It can make a huge difference in the overall outcome. So if you are dealing with chronic pain or someone whom you know is, please don't hesitate to seek help. Talk to professionals, explore various options. Ultimately, it's what works best for you. Above all, don't lose hope. Remember, you're not alone in this journey, and with the right approach, it's possible to live a fulfilling life despite all the challenges that chronic pain can bring. Thank you for taking your time today. Have a great day. Thank you.
Thank you, Dr. Adira. Next is Dr. Sankram Nayak. He's a resident from KIMS, Bangalore. He'll be joining us online.
Share the screen.
Okay, screen sharing.
Dr. Sankram?
You have to stop screen
Yes,
sharing.
Our screen sharing should be stopped.
Let him co-host. He can.
You can share your PPT.
Yes,
Yeah.
sir.
Let me know once you're ready. We'll start the time.
Am I audible?
Yeah, you are audible, sir.
Good evening, all. This is Dr. Sankram Nayak. I'm from KIMS Bangalore. I'm the first year PG in psychiatry. And thank you everyone for giving me this wonderful
spotlight.
opportunity.
Pin that. Yeah, please go.
Today, I'll be talking about suicide in the elderly. Suicide in the elderly is often under-researched in India, and it poses a major challenge to psychiatrists and that work with elderly patients in the community. The risk of suicide in the elderly is often neglected, and it is not appreciated during the clinical assessment. And lack of geriatric mental health services in many areas has also compounded the problem in many ways. And let's talk about the statistics. So the suicide in elderly are more common among the men, and the causes include the chronic illness, pain, social isolation, loneliness, loss of loved one, grief, cognitive decline, dementia,
access to lethal means. And there are certain risk factors which are associated with it, including male gender, advanced age, living alone, history of mental health condition, and also family history, substance use, or there are other conditions like recurrent elder abuse, or presence of stroke or other paralysis, or advanced stages of dementia. And basically, the major depression causes 70 to 90% of the risk in elderly individuals. So what are the signs and symptoms? So we will see there is sudden changes in the mood and behavior, and withdrawal from social activities, increased talk of death and dying, giving away all the possessions, sudden changes in the wills or the estate plans. All these things will suggest that the patient is having suicidal ideation in his mind. So there are certain assessment scales like Geriatric Depression Scale, Hamilton Rating Scale, Patient Health Questionnaire. All these scales, along with detailed psychiatric history, will help us to assess the risk and the appropriate management we can take care of. There are some certain preventive strategies which include foster social connection and community engagement, monitor and treat mental health conditions, provide access to mental health resources and support, encourage open conversation about concerns, remove access to lethal means, spread awareness in the area of mental health for the elderly and geriatric population. For the geriatric suicide, population-based general strategies can be implemented, improving access to palliative and mental health care, suicide preventive initiative, and psychoeducation is very important. So in the end, I would like to tell that suicide in elderly is a major public health problem. It needs proper attention, and it's essential to address suicide with compassion, understanding, and comprehensive approach that involves healthcare providers, family members, and community support. Thank you.
Thank you, Dr. Sankram. Next, we have Dr. Surabhi ji. She's a resident from BMC Bangalore.
Screen sharing can stop from there.
Done.
Hello, can we raise questions at the end?
This is a session where there is no questioning at all. No questions are allowed. We'll talk about it separately, Ramnath.
Okay, I have put it in the chat box.
Yes, please. Yes, please. Thank you.
Maybe after the sessions are over, then we can see.
Ready? Can start.
Yeah, you are audible, ma.
Good evening, everyone. I myself, Dr. Surabhi, second year PG resident from BMCRI. Thank you for joining us today to discuss the increasingly relevant topic of embracing a healthy lifestyle as we age. Aging brings changes and challenges, but also opportunities for growth. With global aging population on the rise, it's crucial to ensure that our later years are lived in good health. Today, we will explore how embracing healthy habits in nutrition, exercise, sleep, mental well-being, and social engagement can improve our quality of lives as we age. So, why is this discussion so crucial? Aging is inevitable, but the way we age can be influenced by our lifestyle choices. The aging population is set to nearly double And with this increasing comes a greater burden on healthcare system, economies, and families. The more we understand and promote a healthy lifestyle, the better prepared we will be to manage these challenges. Research shows that a healthy lifestyle can significantly increase life expectancy and, more importantly, reduce the years lived with disability. This means that by taking care of our bodies and minds, we can enjoy not only a longer life, but also one with greater independence and fewer health complications. Prevention through a healthy lifestyle become a powerful tool in combating the disease and disabilities often. We must acknowledge the challenges that come with aging. Physical decline is natural and can lead to mobility issues and chronic pain. Emotional loss and social isolation are also significant challenges for older adults, especially if they lose loved ones or independence. These challenges profoundly impact well-being. Chronic conditions like diabetes, heart disease, cognitive decline, and frailty can complicate daily life and increase injury risk. Recognizing these challenges is crucial for addressing them with proactive, healthy lifestyle choices. Despite these challenges, we can maintain and even improve our health as we age by adopting consistent positive habits. A healthy lifestyle begins with nutrition. A diet rich in fruits, vegetables, whole grain, and lean proteins like meat can prevent age-related diseases. For example, antioxidants protect against cellular damage, while calcium and vitamin D support bone health. Exercise is crucial for both physical and mental health. Activities like walking, swimming, dancing, or yoga improve flexibility, balance, and cardiovascular health while reducing stress and anxiety. It's never too late to start. Even a few minutes of daily activity can make a difference. Sleep is essential for overall well-being. Poor sleep can lead to health issues like weakened immunity and memory problems. Prioritizing good sleep hygiene, like a regular sleep schedule in a comfortable environment, can improve sleep quality. Finally, mental well-being is key. Embrace aging with a positive mindset by staying mentally active and socially engaged. Activities like reading, puzzles, and spending time with loved ones help keep the mind sharp and prevent loneliness. As we conclude, let's discuss practical tips for integrating healthy habits into daily life. Stay physically active with activities you enjoy, prioritizing nutrition, and ensure good sleep by managing stress. Embrace aging, but don't let it define you. Stay curious, socially engaged, and open to new experiences. Family and society play vital roles in supporting elderly well-being. Families can help by staying connected through regular gatherings and ensuring healthcare needs are met. Society can create supportive environments with programs and spaces for the elderly, promoting physical activity and providing accessible healthcare. Together, we can ensure our elderly live not just longer, but with vitality, purpose, and joy. Aging is about adding life to years, not just years to life. Thank you.
Thank you, Dr. Surabhi. Next is Dr. Rupali, junior resident from BMC Bangalore.
Yeah, but he said that your thing stopped in 7th cross, so he was waiting there. And I asked him, where are you? He said, he stops here, what can you do? I'm waiting here. I said, no, we are in A.
You're ready?
Yeah.
Just check whether you're audible.
Am I audible?
Yes, ma, you are audible, ma. No problem.
Good evening, everyone. I'm Dr. Rupali, junior resident from Bangalore Medical College. So my topic for today is sleep and elderly. So in India, currently the elderly population makes up to 10% of the total population and is projected to reach double by 2050. Up to 50% of the older adults, age 60 and above, experience sleep difficulties in the form of fragmented sleep with more awakenings. They experience lighter sleep and they experience poor sleep quality, reduced sleep efficiency, and decreased sleep time. So some of these changes in sleep pattern can be attributed to the physiologic changes that they experience as they grow older, which means decline in melatonin levels, which is the sleep hormone that is produced in the human body. So there is a decline in these levels seen. There is a failure of the body's natural 24-hour internal clock in controlling the sleep-wake cycle. And also there's a lowered sleep drive. So why are we discussing sleep? Sleep contributes not only to the well-being of your physical health, by which I mean that a lot of the metabolic processes that happen in the body, which is important for your physical health, is taken care during sleep. And also the consolidation of your memory, which contributes to your cognitive functioning, happens during sleep and also contributes to the emotional well-being. So identifying some of the risk factors or the causes of poor sleep in elderly is important. So as we know, the elderly population experience a lot of chronic medical conditions, such as the cardiopulmonary disorders, such as cardiac issues or chronic lung issues, which contribute to difficulty in breathing, and they have difficulty in falling asleep during night. Or also as something as simple as heartburn, it causes a lot of discomfort during sleep. As was already mentioned in the previous presentations about the chronic pain syndromes, also nocturia, frequent visiting of micturition during night, which is seen as, so the causes of which could be poorly controlled sugars in elderly population. Also in elderly male, enlarged prostate could contribute to nocturia. Also a lot of the medications that they use for something as simple as diabetes or hypertension could contribute to poor sleep. Also, some of the behavioral issues like usage of caffeinated beverages like tea, green tea, and coffee, or usage of smoke, cigarettes, and alcohol. Also, something as simple as daytime napping could contribute to poor sleep in the elderly. Some of the psychological issues like depression and anxiety, and also primary insomnia could contribute to these to poor sleep. So what could be the consequences of poor sleep? It leads to poor concentration and memory. They experience a lot of fatigue. And because of the daytime drowsiness, they can experience falls. Also, some of the worsening of pre-existing medical conditions like high blood pressure, diabetes, chronic lung disease, or cardiac disorders, or cerebrovascular disorders such as stroke. And also they can experience more disturbances. So how can we help them? So some of the strategies for better sleep. Identify and treat the cause is the foremost important step. The next one is sleep hygiene. So as has already been mentioned, you can establish a regular sleep schedule, make the bedroom a relaxing place, eat regular balanced meals, exercise regularly, manage your worries through journaling, avoid electronics before bed, avoid usage of excessive liquids before bed, especially alcohol and caffeine. There are some other options that are available are medications and psychotherapies. So please consult professionals. Ask for help. Thank you.
Thank you, Dr. Rupali. Next student is Dr. Apurva from JJMMC Davangere. She will be joining online.
Good evening, ma'am. Am I audible, ma'am?
Yes, you are.
You're audible.
Make sure.
You can share your slide.
Yes, ma'am. Is the slide visible, ma'am?
Yeah, it's visible.
Share mode. Go to slide share.
Go to slide share mode.
Yes, ma'am. Is it visible, ma'am?
Yeah, it's visible.
Okay, ma'am. I'll start.
Ready? Okay.
A very warm good evening to all. Today, I, Dr. Apurva Sharma, second year resident psychiatry from JJM Medical College, would like to share a few words on depression. So let's begin. What is depression? Depression, meaning feelings of sadness, can be experienced by everybody. This is related to an event, mild, short-lasting, does not hinder day-to-day activities. Depression actually as a psychological condition can be due to psychological causes or physical causes, both. Psychological causes, that is inability to appropriately handle stressful events in life. Physical causes, biochemical abnormalities in brain or other bodily diseases. Such a condition lasts longer, hinders day-to-day activities and needs treatment. Unfortunately, depression is not recognized early, leading to a lot of distress in people. Coming to the next part. So what do you mean by depression, or what does it actually look like? So basically, continuous feelings of sadness, irritability, fearfulness, feeling forgetful, inability to concentrate. It can also present as loss of interest in daily activities which were pleasurable before, decreased sleep and appetite, generalized body pains, weakness, easy fatigability, feelings that one is worthless, there is no hope in future and cannot modify troublesome situations. Feelings of guilt even though the person has not committed anything wrong, ideas or attempts to commit suicide. It can range from mild to moderate to severe in intensity. Now next, coming to risk factors.
Volume is less, madam. Slightly louder.
Yes, sir.
Very good to hear you. You can go ahead.
You can go ahead.
Okay. So the risk factors, elderly adults having a higher chance to develop depression. So risk factors are of two types basically, psychological and biological risk factors. Psychological risk factors, that is arising from inside the person's mind. For example, loss of a loved one like death of spouse, family member or friend. Major life changes like retirement, moving to a new environment, children moving away, that is marriage, war, job, that is, it causes emptiness syndrome in the elderly people. Then financial constraints, residents of old age homes with no family or social support. Coming to the biological risk factors, that is arising outside one's mind. So uncontrolled diabetes, hypertension, heart disease, stroke leading to disability, chronic pain conditions, bedridden patients requiring continuous care and assistance, side effects of certain medications and alcohol use. What is the impact? So basically, depression lowers one's quality of life, leading to isolation and loneliness, deteriorates other medical conditions, leading to frequent hospitalization and increased cost of healthcare. Now, I would like to discuss how to manage depression. So there are two kinds of modalities present for the same. One is psychological and one is physical. Psychological includes counseling and therapy. So discuss with doctors about handling the stressful situations in a better way, accepting the situation if not modifiable. Activities like walking, meditation, praying, music, socializing, having an optimistic outlook overall, then accepting the limitations brought by old age. Physical, medicines which reduce depression, which are called as antidepressants, act by correcting the chemical abnormalities. Adequate control of associated physical illnesses through appropriate medicines and physiotherapy. So what is the take-home message from the depression slide? So depression is something that can affect anyone, even older adults, but it is important to remember that it is not a normal part of aging. Talking about how you feel or encouraging a loved one to share their feelings is the first step. Don't hesitate to seek help from a doctor, counselor, or a trusted person in your life. With timely support and treatment, things can improve. Remember, no one should have to suffer in silence. If we recognize the signs of depression early and seek help, we can make a real difference in the lives of our elderly loved ones. Let's break the silence around depression and ensure that everyone gets the care and support they need. Thank you so much for giving me an opportunity to speak on the topic.
Thank you, Dr. Apurva. Next resident is Dr. Vrishali S. Patil. She is also from JJMMC Davangere. She'll be joining online.
Good evening, everyone. Is it audible?
Yeah, it's audible. You can start.
Good evening, everyone. My name is Rupali. I am from Davangere, JJM Medical College, first year psychiatry resident. Here is my topic on lifestyle. Coming to healthy aging is a process of developing and maintaining the functional abilities that enable well-being. What are functional abilities? It is functional ability is nothing but a person's ability to meet their basic needs, makes a decision, build and maintain a relationship, and as well as contributing to the society. Healthy aging also impact on as we age, we choose some of the we choose which impacts on our day-to-day life, like quality of life, life satisfaction, and longevity. Healthy aging is attributable to interlinked, like lifestyle. It is interlinked with lifestyle, mental health, physical health, and as well as stress. Here, the image it also shows that how lifestyle changes has to be done, has to be modified, such as cognitive activity and diet and nutrition, and as well as physical activity, exercise, and as well as in community participation, how it matters in healthy aging. Coming to the first part is nothing but physical activity for optimal health. Physical activity which enhances our strength and as well as flexibility.
You can continue.
Thank you. Physical activity which enhances our strength and as well as flexibility. It also improves balance. It heightens the self-confidence and as well as it tries to have an independence of life. It also involves the exercise that elevate the heart rate and as well as breathing. Physical activity for at least for 150 minutes of moderate intensity activity per week, it has to be regulated. Coming to the next, the power of balanced diet. It is a key for healthy aging. As we know, Jaisa An Vaisa Man. So this is the power of balanced diet. The diet affects the connection between your gut and as well as your brain. Whatever you eat, that all impacts on your brain, which is called gut-brain axis. This balanced diet also support for us physical health as well as and it also helps for our brain function. This balanced diet approach, it helps you to not only to stay active, but also it helps to enjoy the better life as you age. The diagram depicts here about the diet plate, healthy eating plate, which contains more amount of vegetable, fruits, and as well as adequate hydration, and as well as protein, minerals, calcium, and all, which helps the old age people to have a balanced diet and to have optimum activity all throughout their life. Coming to the next is the simple steps for a better sleep as you age. Some of the sleep health tips for the older adults, like get a regular daily light exposure and a moderate to vigorous exercise, like increasing the light exposure during the day, get for 45 to 60 minutes of bright outdoor light over the course of day, combining it with the walk for an added benefit. And some of them like have a consistent routine, including timing of meals. Consistent routine helps to regularize the sleep wake cycle. Just don't eat within 2 to 3 hours of bedtime. Optimizing the environmental conditions like a dark, quiet, and cool, and a clean that are under control. A comfortable sleep environment is very important to promote healthy sleep. Set a consistent bed and rise time. Allow for at least 7 to 8 hours of sleep. Coming to next is the role of community and avoiding the addictive habits. The habits such as smoking, drinking, alcohol, and chewing tobacco can harm your health as you age. Community activities helps it build up emotional strength. Connection can also reduce the feeling of loneliness, depression, anxiety in the older adults. I wanted to conclude my topic saying that healthy aging in the older population can be achieved by the lifestyle modifications such as balanced diet, physical activity, adequate sleep, engagement in the social engagement and the social communication, and to avoid the harmful substances, and emphasizing the importance of mental well-being by reducing stress and fostering social connections. Older adults can enhance the quality of life, promote independence, and enjoy fulfilling healthy aging by adopting these life style changes or modification. Thank you all for granting me such a opportunity to share my view. Thank you one and all.
Thank you, Dr. Vrishali. Next, we have Dr. Anusha from BMC Bangalore.
Questions, all of the questions, madam. We can announce that last two presentations are there. Two more presentations. There are only, yeah, you can announce.
We have 2 more presentations left.
No questions. Questions are left. That's because it can be taken.
The message in the group.
Announce anything. People.
Am I audible?
You are.
You're ready? Okay, can start.
Good evening, everyone. I'm Dr. Anusha CH, first year resident from BMCRI. I'm here to talk about palliative care. I would like to thank everyone for giving me this opportunity to talk about such an interesting and emerging field in medicine. First, I would like to start off with the story. A banyan-tree and an elderly man. In a small Indian village, an old banyan tree stood at the center, loved by all. Dadaji, an elderly villager, had spent many years resting under its shade, sharing stories and bringing back fruits for daily usage. But as he grew older, it became very difficult for him to visit the tree daily. Seeing this, his grandson, Rohan, decided to bring the village to Dadaji. Every evening, Rohan would visit Dadaji's home, sharing stories and bringing fruits, just as they used to do under the banyan tree. One day, Dadaji smiled and said, "Rohan, you have brought the heart of the village to me. I don't need to go to the tree. I feel its presence here with you." So this story highlights that that love and care that is received by the elderly gentleman here is what truly mattered to him as he ages. As we grow and as we age and grow older, we lose our physical strength. We acquire newer illnesses like heart disease, stroke, neurological disorders, dementia, Parkinson's, cancer. The loss of vitality can lead to feelings of frustration, helplessness, which lead to anxiety, depression, and sense of isolation. Together with these physical and mental challenges, it can impact the quality of life in older adults. That's where palliative care comes in. According to WHO, palliative care relieves suffering and improves the quality of life for patients and families dealing with any type of life-threatening illness. The 5 domains of palliative care is physical care, social care, emotional care, spiritual care, and cultural care. The key components of palliative care include physical care, emotional and psychological support, quality of life, social supports, again spiritual care, the ethical and legal support, communication and coordination, bereavement support, interdisciplinary team approach, education and support for the caregivers. Global burden of death annually is 26 million, out of which 60%, that is 33 million, need palliative care. This highlights the importance of it. Palliative care has a holistic approach which respects dignity and worth of each person, promotes healthy aging, and helps patient avoid the avoidable suffering like chemotherapy side effects, pain, nausea, vomiting, diarrhea, and constipation. It also helps in building capacity to adjust, adapt, and support the unavoidable suffering like death. The major focus of palliative care is improving quality of life of patients and uphold their autonomy and increase the support throughout the illness. They also help the family in emotional support and bereavement process. So who is actually involved in palliative care? Doctors, nursing staff, psychologists, physiotherapists, social workers, volunteers, and everyone, whoever is needed to support the patient in an individualized setup are involved in palliative care. And when does it usually start? From the time of the diagnosis till the end of life, palliative care covers all age group and all stages of disease to improve quality of life. I would like to talk about a component of palliative care, that is hospice care, which is available for individuals with a poor prognosis of 6 months or less. This care majorly involves improving quality of life with no curative therapies, unlike palliative care. No curative therapies are tried to prolong life. It is majorly in house care, in-house care, as many people want to spend the last days at home among their loved ones. Burden of care would be taken care of the hospice staff to improve quality of life, quality of time spent with family. These are all the palliative care centers found in Karnataka, and WHO has also taken an initiative to improve, to inculcate palliative care in PHCs. So that would be one step to provide care for patients. Thank you.
Thank you, Dr. Anusha. Our final participant is Dr. Janani from BMC Bangalore.
Good evening, everyone. I'm Dr. Janani R, final year resident, Bangalore Medical College and Research Institute. I will be talking about loneliness in elderly. Now, as we age, life inevitably brings about changes which can lead to an increasing sense of social isolation. These changes include, imagine losing a spouse, a close friend, or a family member, following which the world becomes a little more colder and a little less familiar. Retirement, which was once the most anticipated milestone, can actually strip away the daily conversations which give meaning and purpose to life. Health issues like chronic illnesses, difficulties in hearing and vision, and restricted mobility, all this can make it difficult for individuals to take part in activities which they previously enjoyed. This is exactly what the senior citizens in our country have to do. A significant proportion of the elders live alone, isolated away from family and friends. This is also because of an increased emphasis on nuclear families and in the background of our fast-paced urban lifestyles, which causes our elderly individuals to feel isolated from the very communities they build. The consequences of loneliness are quite devastating. They are associated with significant mental health issues like depression, anxiety, stress, anger outbursts, suicide, and even increased risk of psychosis. It is also associated with cognitive decline, even leading to dementia. Not only mental health, it is also associated with significant physical health risks like increased heart disease, increased risk of hypertension, and also a weakened immune system. As per the longitudinal aging study of India, which was done involving multiple states and union territories in India, including 72,000 elderly individuals, the prevalence of loneliness was as high as 13.4%. As you can see in the graph, South Indian states like Karnataka also ranked very high in the loneliness index. As per World Health Organization, loneliness is as deadly as smoking 15 cigarettes in a day. Despite these grim statistics, however, all hope is not lost. We can take steps to ensure that the elders in our country do not lead the golden years of their life in isolation. The first step is ensuring social engagement. By providing opportunities for our elders to take part in voluntary activities, community services, and clubs, we can provide them with that sense of belonging. By conducting intergenerational programs where the young interact with the old, it will provide a bond which is mutually beneficial to both groups. We can also harness the power of technology. By teaching our elders how to use social media, video calling, and other digital resources, we can ensure that communication is maintained despite the distance. Mental health support by providing access to counseling services, therapy, therapists, and even medication is essential for elderly suffering from mental health issues.
Support groups are also a key piece in this puzzle, be it for bereavement, for chronic health issues, or just for social interaction and chit-chatting. This can actually help boost the morale of our elderly individuals. Community-based services like Meals on Wheels, camps, and outreach programs can also not only provide essential services, but these can also provide that much needed social interaction, which is essential and helpful for our elderly population. So let us all take steps to ensure that the elderly, the wisdom and the experience of our elderly is not overshadowed by loneliness. Together, we can create a community where all the elderly feel heard, respected, and loved, and surrounded by a loving network of companionship. Thank you.
We have come to the end of the presentations. Before I move on, I have a duty to welcome Professor Somshekar Bijjal, who is a guest of honor today. Your video is not, we cannot see your video. Dr. Bijjal. Okay. And Mr. P. Tangaraju, who is our VMS core committee member. Mr. Jambunathan as well, who is our core committee member.
Good evening to all, sir. Good evening. Thank you very much for your kind invitation. Apologies.
Sir, you are muted.
Yeah. So your maybe a problem with your signal. I think some issue. So
Yeah.
yes, sir.
Please come back.
Vijay,
you want
yes,
to
sir.
Can you say a few words, please?
Actually, it was, we are happy that Vayomanasa Sanjeevani is the one program which has crossed the 200th mark today. So it's one of the milestones which it has created. And this is one of the longest webinar series which have been done for the general public so far. Maybe we're heading towards setting a Limca Book of Records, if I am not wrong. Maybe we need to send this to some records book. That is, of course, along with that, there is one more competitor, the Thursday Musings, which is for the professionals. But for the general public, this is one of the longest run information education communication program, health education program. So which has been done by Vayomanasa Sanjeevani NIMHANS initiative along with IPSKC with its co-partner. So the whole credit goes to the Department of Psychiatry, Geriatric Unit headed by Dr. PTS and Dr. Vijay and Dr. Preeti and others. And today's Blitz presentation is one of its kind. As we all know that the geriatric population is quite increasing because of the increasing life expectancy rate as well as the decreased death rate and at the same time changes are happening quite frequently in the world all around in various aspects. You can take it as a climate, you can take it as the social changes, religious changes, the digitalization, globalization, all those things. So which has made the of the geriatric population because of the migration and all, especially migration of the younger population towards the urban areas, which made geriatric populations more vulnerable for the loneliness, as somebody was last this thing where she was pointed out well. So that is one. Along with that, the increasing non-communicable diseases, even though the world is heading towards the decrease in the trend of communicable diseases, the increase in non-communicable diseases and especially the carcinomas, metabolic syndromes, so which are all contributing to the progress of the memory impairment, cognitive impairment, especially so which need to be addressed in time. Otherwise, there is really a significant burden for the, especially not only to the people who are geriatrics, but also the caregivers also. In this aspect, today's Blitz presentation is an eye-opener where the young generation will learn about what are the difficulties faced by the geriatric population as well as the caregivers. So it was a quite fantastic, nice presentations done by many of the people. Of course, I missed around four people in the beginning. Yeah. So it was nice. Thank you, VMS NIMHANS team for organizing this event. Thank you, sir. Thank you, PTS and Dr. Harbi.
Okay, that was Professor Somshika Bijal, head of the Department of Psychiatry at JIMS Gadag. And I also have a duty and he's also Vice President of the Indian Psychiatric Society, Karnataka chapter, who is taking over in 3-4 days time as a president. And we have our VMS is in collaboration with IPS Karnataka chapter as well as the Indian Association of Geriatric Mental Health, Association for Geriatric Mental Health rather, Samadhana Counseling Center, and of course we are part of Department of Psychiatry, NIMHANS. Okay, so I also have a duty to thank our jury members before who have helped in shortlisting. Dr. Saraswati Tengi, who is a faculty at who is a senior psychiatrist faculty at the Boring Hospital in Bangalore, as well as Professor Ravish BN, who is head of Department of Psychiatry at Mysore Medical College, Mysore. Without wasting much time, I'll invite Dr. Professor Shikala Bharat to say a few words and share her experience. We can get enlightened from her with her all experience she's got. Thank you, ma'am. And after that,
before the drive, I will use madam.
Yeah. Okay. I request. Yeah.
Okay. Okay.
He did the introduction.
Okay. Okay.
Namaskara. It's really an honor, and it's also a very, very pleasurable thing to be back in NIMHANS, and especially with the geriatric unit, and be back with the colleagues like PT Sivakumar and Vijay. It always makes you young, because though I am in the whatever you talked about, the elderly, when you come back and then be with students and other young colleagues, you always feel younger, and of course you gather a lot of information. Somu, I have not left you out. Everybody calls you Bijal, but I do not know. I always call you Somu. So I also congratulate the geriatric unit.
Thank you, ma'am. Thank you.
For this long-running 200 Public Awareness Forum every week. I think it is not only congratulations to the geriatric unit, but also a lot of the volunteers who have taken the initiative, and they have been running programs on their own, in their own languages, in different parts, and they choose a day and they plan to choose a topic, call somebody. And so it is a lot of collaborative effort, both from the professionals and also the public. So this is a good example of how a public and the professionals can work together and make a difference. Because I think one of the things which the public can also bring about is a lot of advocacy. Because you all talked about loneliness, death and dying, palliative care, elder home, all these things, if they have to be addressed in some way, then the public and the professionals have to be high on advocacy for the system to work, because it is not only the professionals who are in a hospital, because most of the professionals are in a hospital, but the whole system has to work. That means the government, administration, everything has to work together, and there should be policies also. There should be they should say, just as we have certain laws, to have a reception center, destitute home in each district. We should have an elder care home run either by the government or by private parties, because one is, of course, people who cannot afford it. So the government has to either run it or subsidize it. If it is not by the government, then of course, people who can, somebody talked about people who can afford, then it is more so with the private parties. And I think it is necessary that we also people talked about the daycare and everything. A lot of these things, whatever you have spoken about, are there in the Western world. But they are all, for the population we have, they are just, almost nil, I should say, in our country. And it is all restricted only to metros. It is not there. If you look at palliative care, carcinoma has been there for time immemorable. Leave the elderly. But even for malignancy and cancer, the palliative care often is not present in many of the rural areas. And if you hear some of the forerunners of palliative care, That's what they say, that when you go to a rural area and do palliative care, it is so different from what you see in the urban cities. I remember Dr. Rajagopal, who started the whole program in Kerala. He said, when I went to an old lady's house for palliative care, my idea was not pain reduction. My idea was she didn't want to die because she had a young, granddaughter. And the house did not have a door. And they were so unsafe. So my main thing for the palliation of that lady was getting a door done rather than giving her morphine. So these are some of the things which you would, people learn as they go along when you talk about various issues in the elderly. Okay, so very important. And I think this collaboration is very appreciable. It should continue. And I think you all can be the torch bearers because you're all, stepping into your career. Many of you may, some of you, at least not many of you, some of you may choose to become, specialists in old age, mental health. And you need to continue doing wherever you are, like, whether you are in a metro or in a Tier 2 or Tier 3 service, you need to continue to look at the issues based on the need of the population who are around you, rather than looking at what is available in the Western society has gone way, way ahead. So we need to look at what is available in our own society and what is the need of the elderly there and how we can address it in a manner which is possible for us. That's why I like the last story where the boy Rohan brings the community to the grandfather rather than, trying to say that I should set up an elder home or take the grandfather and put him in a home. So it's very important that we understand the need and then we work towards it. And of course, as I said, advocacy and policy will help it. I definitely, Vijay said no questions. I do not know about the people who are on the panel there, all the people who are part of the VMS, but you as young people, one of the things which I found is most of you were highly professional in your presentation because this is for the public. So the topics were all very, very appropriate. I congratulate you for that. So we talked about loneliness, suicide, palliative care, chronic pain, very important. Somebody talked about sleep. Excellent. So all the topics chosen were very good. So, and very relevant to the elderly. Okay. But when you spoke about it, I think except Janini, that's what I have written. She only said I. Let's not allow the elderly to, be lonely and things like that. So all of you talked about statistics, vulnerability, risk factors, which I am, if I am a person from, SSLC or 12th standard pass from Gulbarga or any other place, I may not understand much of it. So when you're talking with the public, your language, your jargon has to change. Unless you change it, it will go above everybody. And you need to be part of it. You're all young. Probably, old age is not something which you can even imagine about. And you need to be part of it because you, as I said, you have a responsibility when you become a professional. So that is something which is very, very important. And I think one of the things you should avoid is Western pictures. Western, white people and white setups and things like that. As I said, many of the things which they have, we do not have, and probably we cannot even imagine having them in the next probably, 30 to 40 years. Technology is one thing which is catching up very fast, but you have to set up a daycare center. It's going to be a, very, very ordeal. So better to avoid Western pictures and Western setups and then see whatever is available here. Otherwise, just leave it. And some of the things which needed to be brought out, I'm sure the people on the screen also would agree. A lot of in the healthy aging, the way we look at life, a lot of gratitude, a lot of forgiveness Many people are very unhappy because they don't forgive things, past things. So these are some things which I constantly talk about life skills in elderly, that you need to let go of things. If you do not let go of some of the hardships, bad childhood, bad marriages, unforgiving children or grandchildren, if you do not forgive them, you are going to die the death is going to be, dying is going to be more painful than the old person sort of planned. And gratitude and then I think finding relevance. If you look at many of the people, centenarians, and I think many of the people who are on the screen, they find a relevance, a purpose, even at the age of 90 or 100. So a purpose is what we talk about spirituality, more than religion. Religion is very important, especially in elderly. Religion is important for a healthy lifestyle. But spirituality is finding a relevance. Why am I here and what am I here for? And that is the most important, I think, for each one of us. Why am I here? And if that is we understand, we can have a reasonable, healthy aging, apart from all the other things. Every sentence of what you have said is very, very appropriate and relevant. Okay, so that's very important. But elderly need, because as I said, we need to find a purpose in our life. Many a times it becomes so mechanical that we do not know, why am I doing what I am doing? Instead of that, yes, I find it meaningful is what we all need. And I think with that, I'll stop here, and thank you for inviting me. As I said, it's more a bonus for me than for them.
You want to announce winners, ma'am? Please.
I have no idea. Okay. I've just marked. So
marks were carried forward.
Back and forth and changed marks based on whatever happened.
The marks is not entirely based on madams. It's also been carried forward.
Yeah. It is apparently whatever you scored earlier by those people and then mine. So
includes evaluation by the abstract.
50% from them, 50% from ma'am.
Okay, so who is it? Padmini? No, Hashita.
P. Hashita.
P. Hashita. Yeah. So 2 first places.
Can JJM team come on video, please?
Neha.
Join first, right?
Janani, second, and Anusha is third. Congratulations and good. But I found that all the presentations were very good and I enjoyed them and quite inclusive, except that I didn't find the first person, that somebody else was doing your work.
Over to Professor P.D. Sivakumar for final few words. Say a few words and concluding remarks, and also a word of thanks, please. Thank you.
Yeah. So thank you very much. I think it's a very important occasion for us. We would have actually planned it in a bigger manner, but for the ongoing lot of protests and strike, we all have been sharing the agony and pain of losing a very important young doctor in Kolkata, and all of our doctors are in protest. Despite that, there are some activities we wanted to continue. This is a public awareness activity. So that is why we continued. And in fact, many of our residents are in protest. We didn't want to make it as a big occasion where we are inviting a lot of people. So Madam has agreed to come today and chair, and then in a very short notice. And I would like to thank Madam, and Dr. Shikla, Madam was one of the founders of the Geriatric Psychiatry Service in NIMHANS. Dr. Matthew Verghese and Dr. Shikla, they both started in 1999. So we are in the 25th year of our Geriatric Psychiatry Services at NIMHANS. We are celebrating the Silver Jubilee. And on this occasion, we are also happy to have this 200th episode of the VMS. In fact, there are other sessions in Kannada, in Tamil, as well as there are small group sessions that is happening. It would be more than 200 if you count everything else. But this is something like, this is the main session which has been happening, hosted by our team. And for a long time now, Dr. Vijay has been coordinating this on a regular manner. And a lot of people who have spared their time and then participated in various faculty, not only the faculty from psychiatry, various medical disciplines, as well as other stakeholders who are involved in geriatric care have actually contributed to this. And I have to recollect and acknowledge all the senior citizens and who are active volunteers who have been the strength of this program. We have not been kind of promoting it too much, but still it is kind of surviving because of their sparing the time. And then we are able to have some program for their relevance. We still want to improve it into further, and then see, we need to continue this as an opportunity for us to contribute to the public engagement and public awareness, and also exposure for our trainees as well as younger trainees. Today, I think we had for this competition, a short notice, we had a tremendous response. More than 30 applications were there with abstracts, out of which we reviewed, and then all 12, and in fact, I would say all 30 are winners, in the sense that people participating and showing the enthusiasm is a very important thing. I would like to appreciate all 30 of them. And as a token of gesture, we would like to invite all of you for the Geron conference that is going to be hosted by NIMHANS on 13th and 14th, with a pre-conference workshop on 12th, and which will again be a celebration of our 25th year of geriatric psychiatry. So I think all 12 who had presented today was excellent, and I appreciate the spirit and the way how you kind of prepared in a short notice. And even today, after 20 years of experience, I'm for each presentation I'm learning, and it's always we feel that we can do better, we can improve. So this is a journey what you are starting. So it is something which is very, very important for you to start this journey. And I thank Dr. Prashant, HOD of the BMCRI, and the other colleges like Davangere, and all the faculty who had encouraged students to participate despite the troubled times what we are going through. And I would also like to announce that for all the 12 of you, we would be happy to have you as a free registration, and if somebody from outstation, we would give a free accommodation in our guest house, and we would welcome you for the conference. And we'll also announce this as a fellowship so that you can use it in your CV. And apart from the prize, all the 12 participants, we would try to give it as a certificate, which can be helpful for you in your CV also. So, and participation certificate will be issued for all the 30 applicants who had actually participated and who had submitted the abstract. And would invite you to support us through in your future, and by sharing your word with whoever, because elderly are there everywhere. So whenever you meet elderly people, you can tell and refer this program. People can access this both in videos as well as attend the live programs and contribute to it. We'll also be sharing you the book of Insights for Healthy Aging, which is available both in English and Kannada. Unfortunately, we couldn't get it right away here, but we would ensure that all the participants who had actually participated in it, we'll try to reach it to you either here or in Davangere. We'll try and reach it to you. There's 2 volumes of book, what Dr. Vijaykumar had primarily coordinated. It has 40 chapters on healthy aging, which includes a lot of topics for public awareness. So, which very many authors have contributed. And the Kannada translation is also completed, and it's the second volume is going to be released in the conference this time. Already 1 volume is released. So if you are, we would be happy to share. The soft copies available freely for downloadable, but we'll still hand over the hard copies also for your reference as our gift. So I thank you one and all. Thanks to our team. I think without our team for fellowship trainees and our team to sustain this program will be very difficult. This is not like we also received some support from funding in the initial period, and also to kind of maintain some of the other activities for Vayomanasa Sanjeevani and IPS Karnataka chapter and Indian Association of Geriatric Mental Health and Samadhana Counseling Center. I acknowledge and thank Dr. C.R. Chandrasekhar. He could not be here today because of some other engagement. and my teacher, Shikla Bharat and Matthew Verghese, and all my team, including Preeti Sinha. She is not able to be there because of medical reasons, where she has to be away today. I thank you one and all. Thank you very much. We look forward to your continued support. Thank you.
Thank you, sir.
Thank you, Dr. Singh. Before we
Yes,
conclude,
I thank Mr. Jammunathan, and I thank our team, Jyoti, Fatima, Dr. Divyashri as well, for the support. Okay, with this we conclude. Thank you so much. Have a good day, everyone.
I think we'll distribute the certificate for the prizes in the Geron. So we'll include that. Yes. We'll distribute the prizes. I think that will be an occasion for us